Now, today we will be dealing with the questions from medicine, image-based questions, and there are many questions which are asked as image-based questions, and I will be going through the most important topics, the most high-yield topics, and the most repeated topics which are liable to be asked in your future examinations as well. So, as far as the first question goes, it reads like this: a patient has a hemangiomatous lesion in the cerebellar area as shown. The most likely association is. So over here we have got a hemangiomatous lesion which has been shown. I will just try to enlarge the diagram, and over here you can see that there's a hemangiomatous lesion in the cerebellar area. Now going focus to the question back, the most likely association is. So it asks an association. A part is the TCS complex option, B part is the xeroderma pigmentosa option, C part is the Arnold-Chiari malformation option, and D part is the von Hippel-Lindau disease. So basically, if you see this question, this is a simple question, almost a question in one line. It does not tell you much, but here what the examiner wants to test from you is the association of a pathological lesion in the form of a cerebellar hemangioblastoma or a cerebellar hemangioma, and what it is most likely associated with. And these types of questions are very, very frequently asked. You have to remember what lesion is common in which clinical condition. This is a question combined from the concept of medicine, combined from the concept of pathology. So, as you are aware of the options, TCS complex, xeroderma pigmentosa, Arnold-Chiari malformation, von Hippel-Lindau syndrome, or von Hippel-Lindau disease. Now, as far as these options are concerned, we are well aware of xeroderma pigmentosa being a condition with the defect in the DNA repair, the Arnold-Chiari malformation being almost a congenital defect in most of the cases, characterized with various features. And TCS complex has got tuberous sclerosis complex has got an entirely different spectrum. So what comes to my mind as a simple student, as a student with a it is not that difficult a question, is the von Hippel-Lindau syndrome. And this von Hippel-Lindau syndrome, you have to remember that this disease is characterized by being a autosomal dominant disorder. As you can see over here, it is an autosomal dominant disorder, and it is characterized by the presence of characteristic hemangiomas within the nervous system, more so in the hindbrain, which is the cerebellum. And you have to remember the association of von Hippel-Lindau syndrome, because there can be many other questions which can be asked. This happens to be a favorite question in USMLE. This happens to be a favorite question in MRCP. This happens to be a favorite question in NEET PG. And you have to remember that other features of VHL are pheochromocytomas, bilateral renal carcinomas, and in addition to that, you can have the lesions in the eye in the form of angiomas, the retinal angiomas, and the renal cysts, the pancreatic cysts, and epididymal cystadenomas. So it is very important to remember VHL. VHL is a very important topic. It is a high yield topic in addition to tuberous sclerosis complex as well, which has got an entirely different spectrum. So this question has been taken as a question from a high yield topic. So remember cerebellar hemangioblastomas, pheochromocytomas, renal cell carcinomas, retinal angiomas, renal cysts as well, and the pancreatic cysts, which can occur in association with cerebellar hemangiomas as well as VHL syndrome. So that is very, very important. Now going on to the next question. The patient in the figure is shown below, and it reads that the patient is toxic and shows extensive skin denudation. So you can see by the pointer that there are denuded patches of skin. There is extensive involvement of mucosae as well. So the question says that the mucosa are involved. Most likely the patient is having TENS. So the diagnosis is given there. The likely organism implicated is. So this question is a question which just tends to know your knowledge of pathology. So as far as the options are concerned, we go to the corner, and option A, option B, option C, option D. Read as Clostridium, bacteroids, staph, and pseudomonas. So I think that this question, now you can see this is again an image based question, and you can see that there are denuded patches of skin extensive. The patient is toxic and the diagnosis given is TENS. Now TENS, you have to remember some of the abbreviations. Toxic epidermal necrosis. So toxic epidermal necrosis, you are well aware of an entity, and you have to remember, you should be knowing it already, that TENS is secondary usually to staph infections. In fact, Staphylococcus aureus is one of the most important organisms which causes toxic epidermal necrosis. And toxic epidermal necrosis is characterized by extensive destruction as well as widespread destruction of the epidermis of the skin, and it usually can be fatal. But you have to remember that another important clue given is the mucous membranes. But going back to the question, you have to remember the etiology, that what organism is associated with what disease. So for example, the options over here: pseudomonas. Pseudomonas is a very important organism. It is implicated in certain diseases, in certain abscesses, as well as hot tub folliculitis, a question asked previously in NEET, PG, and FMGE. Staph aureus, the organism, which is the answer over here, is characterized by being the most common organism for acute hematogenous osteomyelitis, for acute mastitis, for acute bacterial endocarditis, for botromycosis, and many other conditions, including furunculosis. So you are well aware of that. Bacteroids, they are usually associated with infections of the gut. Once there's trauma to the gut, the bacteroids just play a very important role. Clostridium various species, they are implicated in causation of gas, gangrene, botulism, and many other diseases. So this is a image-based question, a very pretty simple question, and you have to remember this thing. Now, going to the other question, the CXR stands for chest X-ray, basically chest radiograph. Below shows Cannonball metastasis. So you are seeing over here what has been illustrated as Cannonball metastasis in the question itself. They are usually seen in association with. So the patient has got Cannonball metastasis within the lungs, and you have to answer the question in the form of association. Again, the importance of association in many clinical questions as far as medicine is concerned. RCC means renal cell carcinoma, pinealoma, thymoma, and enchondroma. Now, there is this characteristic feature of Cannonball metastasis, which you see particularly in case of two clinical conditions. One is the renal cell carcinoma, and second is the choriocarcinoma. But over here, the choriocarcinoma option is not mentioned. The other three options mentioned, pinealoma, thymoma, and chondroma, very, 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 very rare things, and they are not associated with Cannonball metastasis. So renal cell carcinomas tend to produce this characteristic feature, which is the Cannonball metastasis in the lungs. So after a patient is diagnosed with RCC, usually you should do a scan of the lungs and look for the Cannonball metastasis in the lungs. So pathologically, they may extend via the renal vein, the RCC extends via the renal vein and inferior vena cava, and there can be blood-borne spread as well, which is given the name as Cannonball metastasis. So these figures are there to be remembered for lifetime, for your examination preparation as well, for your future, say courses like DM, MCH, whatsoever you intend to do in your future course of life. So that is important. Now, another question given over here at the bottom of the screen. In a 44-year-old marathon runner who is sweating and has a bit of breathlessness, ECG strip reveals the wave below. Most likely condition is, so there is a marathon runner who is sweating, has a bit of a breathlessness, and the ECG strip on this side is shown. So as you can see, the ECG strip itself is indicated by a peak T wave. Now over here, AV block is an option mentioned as an answer. Wolff-Parkinson syndrome is another option. Hyperkalemia is an option. Myocardial infarction is an option. So this is a question testing your ability to know where, in which condition we can see peak T waves. So as far as the question goes, marathon runner who is sweating. So you can see that this marathon runners, especially in case of long distance runs. That is what we mean by marathon. It is not a short distance run, and usually they develop hyperkalemia, increased potassium levels in their serum, and the characteristic hyperkalemia is caused by T waves, and in this case, peak T waves. So this is a very classic condition, peak T waves, seen in case of hyperkalemia. In the form of ECG, you have to remember certain other waves like the U waves, like the delta waves, WPWS syndrome, Wolff-Parkinson-White syndrome would be characterized by characteristic delta waves. Then you have the hypokalemia, I mean, say, or other conditions like hypothermia, and in which you can have different characteristic waves. You can have ST elevation in case of MIs. So you have to remember these important features. So peak T waves over here are a feature of hyperkalemia, and you should not confuse with hypokalemia or any other condition. So T waves, hyperkalemia. That is important. Now, over here, at another question, a 33-year-old male has shortness of breath. He was admitted in ICU. The ECG shows abnormal wave. The abnormal wave is a feature of. Now over here, there is what I just previously mentioned. This is a normal wave on the right hand side, and this is an abnormal. So you can see that abnormal ST elevation. The ST segment in this strip is elevated. Characteristic. This is not a strip though, this is simple ST elevation which has been shown over here. And ST elevation, the options mentioned are hypokalemia, infarction, hypercalcemia, hypocalcemia. So as far as this simple question is concerned, it tests your ability to know the wave, the ST elevation, how to detect it, and ST elevation is characteristically seen in case of myocardial infarction. So infarction is the most likely possibility over here, and this thing should be remembered. So by virtue of these questions, though simple, I took up this set of questions because they tend to be very simple. But that does not mean that you will always get simple questions in your examinations. This is just to give you an idea what sort of questions are asked as image-based questions. So I will be continuing further, hopefully, with the similar series, and I hope that at least from this short class of mine, you got an idea what to study, how to study, and the likely types of questions which are asked. Though this is level A, I will be shortly going to level B and level C. So I wish you best of luck for your exams. Thanks a lot.